Breastfeeding after a C-section can be a bit different than after a vaginal delivery. There are some unique challenges and considerations that come with nursing your baby after undergoing major abdominal surgery. It's important to be prepared and informed about what to expect so that you can navigate this journey successfully. One of the first things to keep in mind is that a C-section can affect your milk supply. The stress of surgery, as well as the medications used during and after the procedure, can sometimes impact your body's ability to produce milk. It's important to be patient and give yourself time to establish a good milk supply. Make sure to nurse your baby frequently and on demand to help stimulate milk production. Another challenge that many women face after a C-section is finding a comfortable breastfeeding position. The incision site can be tender and sore, making it difficult to find a position that doesn't cause pain. It may take some trial and error to find a position that works for you, but don't be afraid to ask for help from a lactation consultant or nurse if you're struggling. It's also important to take care of yourself after a C-section, as your body needs time to heal. Make sure to get plenty of rest, stay hydrated, and eat a healthy diet to support your milk production. If you're experiencing any pain or discomfort while breastfeeding, don't hesitate to reach out to your healthcare provider for support and guidance. One common concern that many women have after a C-section is whether or not they can breastfeed while taking pain medication. The good news is that most pain medications are safe to take while breastfeeding, but it's always a good idea to check with your healthcare provider to make sure. They can help you find a pain management plan that is safe and effective for both you and your baby. Breastfeeding after a C-section can also be emotionally challenging. The recovery process can be long and difficult, and it's normal to feel overwhelmed or discouraged at times. It's important to reach out for support from your partner, family, friends, or a support group if you're struggling. Remember that you're not alone, and there are resources available to help you through this journey. One thing to keep in mind is that breastfeeding can actually help with your recovery after a C-section. The hormones released during breastfeeding can help your uterus contract and shrink back to its pre-pregnancy size more quickly. This can help reduce your risk of complications, such as infection or excessive bleeding. It's also important to be patient with yourself and your baby as you navigate breastfeeding after a C-section. It may take some time to establish a good latch and get into a rhythm with nursing. Don't be discouraged if things don't go perfectly right away. Breastfeeding is a learning process for both you and your baby. If you're struggling with breastfeeding after a C-section, don't hesitate to reach out for help. Lactation consultants, nurses, and other healthcare providers are there to support you and provide guidance. They can help you troubleshoot any issues you're experiencing and offer tips and techniques to make breastfeeding more comfortable and successful. In conclusion, breastfeeding after a C-section can come with its own set of challenges and considerations. It's important to be informed and prepared so that you can navigate this journey successfully. Remember to be patient with yourself and your baby. Take care of yourself and reach out for support if you're struggling. With time, patience, and support, you can overcome any obstacles and establish a successful breastfeeding relationship with your baby.